My name is Lindsay Dye and I'm a nursing student at the University of South Alabama, and today I will be performing the indwelling catheter insertion checkoff. And I will scan the room. So first I need to verify the order and hospital policy. So we have the order to insert or maintain an indwelling catheter, and then I will perform hand hygiene, and I need to identify my patient. So we have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. He has an allergy to penicillin, and he's also wearing his armband for his allergy to penicillin. And so I would now explain the procedure to the patient. I need to indicate or note the indications for an indwelling catheter per nurse driven protocol. So we have required immobilization for surgery, trauma, or therapies, strict urinary output monitoring as indicated by plan of care, and to assist in healing of open sacral or perineal wounds in incontinent patients. And so now I will provide my patient with privacy. I will don my goggles. I will position my trash can, which has already been done, and I will perform hand hygiene. I will raise my patient's bed to a working height. I would lower the side rails. I will place my patient in dorsal recumbent position with her legs slightly bent, and I would place the male patient in the supine position. Now I need to don a pair of clean gloves and provide perineal care with warm water and soap. And so for a male patient, I would provide care by placing a towel under the penis. I would retract the foreskin. If a patient hasn't been circumcised, I would take, I will go around the urethral meatus 3 times in circular motion, going inward to outwards, and rinse and dry if indicated. And then I would clean the scrotum on the upper and lower part, and being sure to get any underlying skin under the penis, and then rinse and dry if indicated. And for the female patient, I would retract the labia, and I would clean the inner skin folds on the patient and rinse and dry if indicated. And then I would retract the labia to expose the urethra, and then I will clean from the perineum to the rectum, and one downward swipe from the outermost labia to the innermost, and then down the center. And then I would need to remove my gloves, glove to glove, skin to skin. And now I need to open my catheter kit. Okay, so I'm going to open my stove wheel. And adjust it. Now I need to don my sterile gloves. Okay, and I need to remove the second. Forwards. Hold it in. Place place it over, being sure that that's under the patient's legs. And then I will move this closer to the patient. I will open my packages. And I will get my lubricant. Open it. Get the lubricant. And then I need to attach my syringe to the balloon port. So I'll remove the cap. Attach the syringe. And then lay that down. I will remove the plastic covering. Then I will lubricate the end of the catheter, 5 to 7 inches for the male patient and 1 to 2 inches for the female patient, and then I will leave that resting there. And so now I need to provide care to the patient before insertion, and so I will retract the labia to expose the urethra. I will take the swab and clean on the farmost side on one swipe, clean on the close side with one swipe, and then clean down the center with one swipe. And then at this time, I would inform the patient that I'm about to begin insertion of the catheter. I would suggest that they bear down as if they were voiding, take a deep breath, and exhale as I insert the catheter. And so I'm going to begin inserting. And then I will insert until I see the backflow of urine into the tubing. Then I will insert 1 to 2 more inches for the female patient. And then for the male patient, I would advance to the bifurcation. And so now I'm going to inflate my balloon. Syringe to the side, and then I'm going to pull back until I reach resistance, and then insert it slightly just to relieve any pressure. And so now I need to get my stat lock, and so for the stat lock I would place the bifurcation inside of the stat lock, like so, and then lock it, and then place it onto the top of the patient's thigh. And just for demonstration purposes, I would unlock it by squeezing it and opening, but for the remainder of the procedure, we're going to keep it locked and place on the patient's thigh. And so now I need to get my bag and hang it on the hang it below the level of the patient's bladder on the bed frame and never the bed rail. Make sure that there is no kinks or dependent loops in the tubing. And so now I need to demonstrate the 2 ways of a urine specimen collection. So I'm going to open my collection cup and place that on the table. For collection, I will have a towel and a graduated cylinder placed on the floor to catch any splashes. And so I will need to remove the port from the drainage bag and place it over the cup, being sure not to touch the inside, and open it and collect the amount of urine needed, and then close it and replace it back in the drainage bag. And then I will come up and replace my lid. I would label the specimen collection and send it to the lab for testing, and then that is used only after the initial insertion of the catheter. And so the next method of collection is through the port, and so I would need to kink the tubing 10 to 15 minutes prior to collection so that the urine can build up, and I would notify the patient of this. I need to get an alcohol swab, clean the port for no less than 15 seconds, and then I will open my container, obtain a luger-lock syringe, and then retract the amount of urine needed for my specimen collection, and then place it into the cup, being sure not to touch the inside yet again. Then I will get the cap, place it, and I would label it and send it to the lab for testing, and then be sure to remove the kink before leaving the patient's room to allow the flow of urine into the bag again. And so that completes the insertion part. So now I need to clean up my supplies and throw it away. Then I will remove gloves, glove, skin to skin. Then I would perform hand hygiene. I would lower the patient's bed back into, lower all the way, raise the side rails, place the patient in a comfortable position, make sure that their call light is in reach, and then I would move to document the procedure. I would document the catheter size. I will document the amount, the color, and the consistency of the urine. I will document the patient's tolerance to the procedure, and I would also document the specimen collection if that was necessary. Then I need to provide catheter care to the patient daily or after the incontinence of stool, and also I need to so now I'm going to move on to the removal of the catheter, and so I need to use aseptic technique. I will have on my goggles. I need to put on a clean pair of gloves. And so first I will collect the remaining urine from the bag. I would collect it in the graduated cylinder and then use the graduated cylinder to measure the amount of urine. And so then I would remove the bag. And then I need to remove the catheter from the stat lock, and I will loosen the plunger, pull it back to 0.5 milliliters, and then place it into the balloon port and allow gravity to release the balloon and fill it. Okay, and so I will remove the catheter and then discard of that, and I'll provide perineal care to the patient. I would remove my gloves, and then I would go to document. I would well, actually, I would need to let the patient know of any the signs and symptoms of a UTI, which would be frequency, urgency, and dysuria, so that they could be aware of those. And then I will go to document. I will document the amount, the color, consistency, odor of the urine. I will document the patient's tolerance to the removal. I will document the amount of water that came out of the balloon, and document the, well, I already documented the urine. And so I would also need to check back with the patient within 4 to 6 hours to check to see if they voided, and if they hadn't, I would need to palpate the bladder and possibly obtain a bladder scan.